like mapping Antarctica, like hundreds, even thousands of miles under the ice surface, and there's like full on. There's like areas of Great Plains in there. There's huge valleys that are carved out by the glaciers. There's even mountains. I mean, like massive alpine mountains that look like, I mean, almost like the Alps, but like fully under the ice shelf. It's like an entire actual like livable continent. Just happens to be covered by like hundreds of miles of ice. It's wild. Like
There's
seeing some
also
of those maps is
another
crazy.
part there too that in back in the 20s we discovered a whole civilization there, but we made a deal with them to keep them invisible. There's all these crazy
Dude,
theories.
the Antarctica conspiracies are crazy.
Yeah, yeah, because it's hard to prove too. Like who goes past a certain amount of Antarctica? There's not much you can explore on your own without any kind of supervision. So
Yeah, and that's like another thing. It's like, the average person, if you go on a mission or voyage or whatever to Antarctica, you can go and see it. You can stand on the ice, you can look at some penguins and see a couple of the outposts, but you can't go beyond a certain point because it's actually blocked off. And that's why there's a lot of theories like, oh my gosh, what are they doing? Is it like a pseudo Area 51? Like, what's happening over there? It, it may just be impassable, you know?
yeah, I mean, there's a lot of flat earthers probably too that talk about how you can't go past because you're gonna fall off because that's the edge of the world. That's why they don't let you see it. These conspiracy theories are crazy. Was when people when people don't know what's going on, they come up with different ideas. I mean, that's how a lot of things in history were created in the past. People couldn't explain certain things, and then they would just come up with theories about it, and people would start
But
believing.
yeah.
Right?
Yeah, they would attribute it to some type of magical or supernatural stuff like thunder. Oh my gosh, that must be from Zeus. It can't be any normal phenomenon. And then you figure it out later.
Yeah, how it works. The Antarctica stuff is interesting. Sometimes
Yeah.
it shows up on my shows up on my YouTube feed. Well, I kind of want to watch it, but I haven't really delved into that. But that's
I
something.
took somewhat of a deep dive, maybe more than a deep dive. I mean, it's just some of the conspiracy theories are so interesting that like aliens are still down there. That's where like we made first contact. There's this stuff about like there's some heat source, like a massive heat source under Antarctica because the entire ice shelf of the whole continent is heating up and it's unexplainable like why it's happening. There's volcanoes in Antarctica under the ice, but it's just there's a lot of interesting stuff. I mean, it's a huge you dive down the rabbit hole.
There becomes these camps in when you come up with conspiracy theories. There's people that truly believe it, and they will come up with any ideas, any theories to explain that. And then there's people that just do not. They refuse to even give any credence to these theories, right?
Yeah.
There's no way. But somewhere, there's a lot of times there's some truth to some of these things, and some of these things are just complete BS. But sometimes I'm in the camp where if I hear something crazy, I think about it. I'm like, could it be true? Could it be,
Yeah, of course.
and then I think about it. I look into it. What are the theories that people are presenting? I like hearing other people's views, and I like hearing these crazy theories because probably in my 20s and mid 20s or teens, I was a complete denier of any kind of craziness. But as I've gotten older and I've realized, man, there's some crazy stuff out there. Conspiracy theories have a lot of reality behind them. How a lot of times the government is involved, how the establishment or the deep state has fingers in a lot of things. And I've started to believe in a lot of conspiracy theories. Not truly believe it, but at least give it some.
Yeah, I mean, I think, like you got to lend a little bit of thought to stuff. Like, there's a reason why some of these conspiracy theories have such a big following is because a lot of the stuff in some of them makes sense. I mean, for example, like Area 51 is a common one that people talk about. Oh, there must be aliens there. Anytime an area is restricted, right? People are going to come up with theories like why. Why is it restricted? Why is the government not allowing access? They must be doing something crazy there. There must be something hidden there that we are not supposed to know. I think that kind of mindset is very appealing. It's like the premise of mystery novels, mystery movies. People just like that. They like creating ideas and fictions around something that they don't know and they're prohibited from knowing.
Yeah, for sure. I mean, there's such a change in our. I was watching this documentary about JFK assassination, and before
Talk about a
JFK.
conspiracy, man. There's some conspiracies floating around about
Yeah.
that.
Well, you're talking the JFK assassination, and that was a big switch in the psyche of the American people because before the JFK assassination and all the investigation afterwards, people used to trust the government. You know, people used to trust the government. They there was, you know, one belief, like what the government told you, people believed that. They're on one page for most part. The news, people believed that. There was one news channel and one show, and you know, that show would come on and people would listen. Everyone would have the same ideas, right? Everyone was united because people just had trust in those institutions. But after the JFK assassination and how it was handled afterwards and the investigations that was done, that's when there was a switch moment where people completely stopped believing in a lot of the government institutions, and then the whole thing with Nixon, and then you know, Iran Contra affair, and you know, the trust in government just completely eroded over time. And I think now I do not trust anything our government institutions have or
Yeah.
anything I hear on mainstream news. I
There's
just
that baseline skeptical. I totally did.
just baseline skepticism, right? And that's what's kind of happened with medicine. If you see, you know, a lot of the health policy has gotten so politicized over time that, you know, when a certain government that's in power at that moment, and the health organization that it's running, like HHS or you know, FDA, whenever they announce something or ban something or approve something, the opposing party or people who are not, you know, supportive of that government just come out against it right away, and they say, no, this is foolish. It has no benefit, no evidence, and how can this government, you know, say that? And when that other party goes out of power and the other party comes in, then the opposite is true. And
Yeah, it's amazing how, like, if you just think about it in very simple terms, human health should not have partisan opinions, right? It shouldn't be dependent on party lines. It doesn't really matter whether your beliefs about government control and involvement should really reflect what happens to the human body in terms of your health. Health is health, right? Or it should be. It doesn't really matter whether you are conservative or liberal in terms of how you vote. What is healthy to eat shouldn't really change. That's my opinion, right? It shouldn't really change based on who happens to be in office for 4 years, because that doesn't really matter in terms of, is this food healthy for me to intake? Is this diet pattern, is this exercise routine good or bad? Exercise is good, whether the person sitting in office is a Democrat or Republican, right? But it's amazing how some dietary guidelines, pharmaceutical guidelines, all of this stuff is politicized, like you're saying. It does matter because the people that make the decisions at the CDC, the FDA, the World Health Organization, all of this stuff, the people that make those decisions have very strong political leanings. They're elected or appointed. And so they're beholden to outside interests.
yeah, it's gotten worse over time because, you know, people would stay on the office, and sometimes, you know, heads of these agencies would have terms in a Democratic government and a Republican government. You know, these people would be nonpartisan, and they would have credentials behind them. They would be physicians or scientists who had long years of research or, you know, credentials that supported the work they were doing. But I think as time has gone on, people in both governments, both the Democrats and the Republicans, have started to kind of pick and choose people to kind of give some, portray some political ideology or make a statement, right? Those statement hires, you know, with the Biden administration, the head of HHS was, and I don't know if they were completely qualified or not, but they were a trans person that was selected, and I don't know if they were picked because they were trans or they were picked because of the credentials. And now with the Trump government, or the Trump administration, now they have picked RFK Jr., who is a lawyer, environmental lawyer by his credentials, right? He's not a scientist, he's not a physician, but he was picked as the leader to lead the HHS and make a lot of health policy in the U.S. Despite all his views throughout the years that were very anti-establishment and not going along with what
And
mainstream.
not in line with real science and real medicine, right? For a lot of things. I mean, his anti-vax stance, his opinions on autism, a lot of this stuff are like very, very fringe. But because of who he is and his clout and now his position in the health and human services, it's gone from fringe to. I mean, I don't know if it's necessarily mainstream, but it's much more popular.
Yeah,
No
much
doubt
more
about it.
popular. And now, you
Yeah.
know, a person who's not as is not as in tune with politics, with keeping up with the news and what's going on, What they just see is this is what the government is saying, and this is what that's presented on the government website when they release the new nutritional guidelines that has an upside down pyramid with a big red stake at the top. There's two kinds of reactions, right? There's people that are like, oh, like the government is now telling you to eat steak and butter, whereas the other side is ignoring everything else that's good with the guidelines and saying, oh, this is just completely ridiculous. Like, what kind of guidelines are these? And let's not, you know, even give any credence or any kind of, substantial credit to this.
Yeah, it's become an all or nothing mindset. You know what I mean? So I think what we could do is we could just distill down a little bit what the new guidelines actually are, because a lot of the hype is that, oh, it's flipped the food pyramid upside down. That's like the catchphrase that you see in a lot of headlines and stuff. The food pyramid began in the 90s, and it wasn't even a thing. It was discontinued, that train of thought, in 2011, and that was a long time ago. In 2011, they switched to that My Plate that Michelle Obama brought about and propagated. But this whole flipping of the pyramid really just stacks at the very top, meaning the biggest category, meaning what you should emphasize as protein, meat, fruits, vegetables, dairy, and healthy or so-called healthy saturated fats. Grains are relatively lower down, and that's what the real flip is, because grains used to be the biggest piece of the older food pyramid, which again has been abandoned in itself for over 15 years.
I think how the marketing was done for this, and just idea of flipping the food pyramid was just presented in the wrong way because there's so many good things about these kind of new guidelines, right? There's a lot of pretty science-based and important things that were supposed to be conveyed through these nutritional guidelines, but the way they presented and marketed it was they just said this is a new flipped food pyramid with a big stake at the top, and that turned off a lot of people. But if you truly look into the guidelines, the first thing they talk about is prioritizing whole minimally processed foods, right? And which is a great thing. Like, try to avoid packaged food, pre-packaged foods, foods that were introduced to us in the 80s, 90s to improve the shelf life. So people, with tons of preservatives, is discouraging us against using those. So prioritizing whole foods and trying to eat mostly minimally processed foods is a very good thing, right? Protein.
Yeah.
Yeah, eating protein, and as we know, most of us are very undernourished in terms of protein. Our body requires a lot more protein for a lot of different things, and protein is a good source of energy and growth for a lot of young growing kids as well. And protein was never highly emphasized in the past. They've talked
Yeah,
about.
one interesting thing that you mentioned, Humayun, just to backtrack for a minute, is you talked about how this has been presented or marketed, really. Because the marketing has become itself so politicized and almost this like very aggressive mindset. The way that everything is marketed is that, well, the previous administrations sucked at it. They did it wrong. They did it bad. And now here's the right way. Here's the real way, which isn't really, how new developments and new breakthroughs in science are traditionally pushed. You don't make a breakthrough in science, a new discovery of a drug, a new way to do a surgery, whatever have you, and just talk shit about everything that existed before, because science builds on itself. It's not I win, you lose. But it's that I win, you lose mindset that I think is corrosive and damaging and loses trust in almost half the population, right? And so even if what you're actually presenting, like the benefit of protein as an example, which is legitimate and it's evidence-based, but if you present it in a way that, oh, what they did in the past was bad, what they did sucked. Now we have the right answer. We're correct. We're winning. Like, that's just a very wrong way to go about it. And I think it turns a lot of people off. Even if the message itself, like the crux of the argument, it might be true.
I mean, no one ever said go and eat processed food, right? The idea of avoiding processed foods has always been around. Now, in the new guidelines, it's a little bit more emphasized, which is a good thing, right? But it wasn't like prior administrations were telling you to go and eat processed foods, and that's kind of how it was presented. But coming back to the guidelines, the other thing to talk about was limiting added sugars, right? And focusing more on refined carbohydrates. That's always been the case. We've always talked about that, but now they're emphasizing that to avoid sugary drinks, avoid high fructose corn syrup, Avoid eating large amounts of desserts. Avoid those, minimize this, and focus more on fruits, vegetables, legumes, things that are carbohydrates, but they're much more complex and are harder to turn into glucose right away to be stored as fat later on, right?
Yeah,
So
really focusing on so-called real food, not just you open a can or you open a package or a plastic wrapper and eat whatever is inside. The argument of going back to real food is a legitimate one because it's like you said, it's more complex foods. Complex meaning it's harder to break down, so it takes more energy. And then, one other interesting thing is with the protein itself. In the past, there's been a lot of talk from nutrition circles, like medical associations, and even the Health and Human Services about with meat in general, limiting red meat and focusing more on poultry and fish. But that's actually not what the new food guidelines say. They really do emphasize red meat as a good sound source of protein, which is interesting. It's different. And from like the heart health perspective, because that's really what a lot of this it kind of is geared towards that. Oh, in the past they say decrease red meat is better for heart health. Add more fish to your diet, more omega fatty acids is better for heart health. I mean, what do you think about that as a cardiologist? Like, is this something that you think is legitimate and evidence based? And like, you would, if a patient asked you, because I'm sure patients will ask you about this, like, hey, the food pyramid has changed. They're saying now I should eat more steak. Like, is that good?
yeah, I mean, there's no question about it that intaking large amounts of saturated fats increases your LDL and ApoB levels, right? We've talked about ApoB and LDL, and we know through clear evidence, and there's a true causation, not just correlation, causation effect from high LDL and high ApoB levels, and causing atherosclerosis in your blood vessels of your heart, your carotids, and your peripheral arteries. So all the big arterial beds in our body, like, are the arteries that supply blood to the heart muscle, the arteries that lead to the brain, and the arteries that supply blood to our foot. Uh, these arteries get atherosclerosis over time, and there's direct correlation with high amounts of LDL and ApoB levels. LDL is a bad type of cholesterol. Traditionally we called it bad cholesterol, LDL, low density lipoprotein, and ApoB, which is how we identify it because it's a little tail attached to the LDL molecule. We identify these molecules through ApoB. So we know that eating saturated fats increases the amounts of ApoB and LDL levels in your body, which in turn leads to atherosclerosis, which is narrowing or plaque buildup in your arteries. So, this was surprising because, the emphasis on saturated fats, having butter, tallow, steak on the top of the food pyramid is dangerous because when you make policy for the large population. You don't make policy for a certain amount of people, right? I mean, as a young person in your teens and your early 20s, your risk for heart disease is low. A lot of the studies have shown that people who are at no risk for heart disease have lower risk for heart disease. Eating saturated fats for they did a 5-year study, and this
Yeah.
that in 5 years there was no harmful effects of saturated fats. Just like I would say, people who smoke, who are at no risk for heart disease, they can smoke all they want because for 5 years there's no risk for any lung cancer or cancer from or heart disease from that. It's even though the studies say that yes, healthy people do not get harmed from eating saturated fats, those same studies show that people who eat saturated fats and have a high risk for heart disease have a much higher chance of getting heart attacks, strokes, or death from heart-related diseases within 5 years. So it does tell you that it does something, right? It does tell you that it does cause harm in people who are at high risk. There's many studies showing that. So, this one study that I talked about, a systematic review of 17 different uh, previous studies, which compared healthy individuals and people who are at high risk of heart disease, and their saturated fat intake, and those who were not at high risk not have any harm, but people who were high risk did show that their risk for heart disease went up. There's another large review which showed that it was a Cochrane study that showed that there was a 17% reduction in heart disease in cardiovascular event when people decreased the amount of saturated fats they were taking and replaced that by polyunsaturated fats. These are the healthier type of fats such as found in olive oil, salmon, and things like that. So obviously we know that there is some harm that goes along with eating saturated fats. Previously, trans fat was also a very harmful thing that was promoted through things like margarine and the big food, big food,
Yeah.
and that also caused a lot of heart disease. So these harmful types of fats that solidify at room temperature, are harmful for you. They cause plaque buildup in the arteries, even though healthier people do not get harmed by that within 5 or 10 years. But if they keep eating it over long term, and if it keeps getting emphasized in our food pyramid, they will get harmed. Just like smoking all your life eventually will lead to cancer or some kind of heart disease.
Yeah, and that's another interesting thing to think about, right? Like when we talk about these studies that show the different effects over this time scale, the 5 years, 10 years time frame in healthier versus unhealthier people, people with risk factors. If you think the average person that is going to potentially adopt this diet, what is the average person? Is the average American more on the healthy side or unhealthy side? Like which cohort in these studies is actually more relevant to figure out and think about for the average person? I think the average person might believe that they're very healthy, but the data is the data. I mean, if you look at just rates of like being obese and overweight, the average American, I mean, there's between 65 to 70% of Americans today are overweight. I mean, that's remarkable. That's so high. I think people in general, if you just take the population at large, the population at large has risk factors. The population at large is not healthy. And so the population at large is much more similar, like you're talking about, Humayun, to the cohort that does have negative effects from eating, 5 years of more saturated fats and 5 years of maybe preferentially red meat versus fish, things like that.
Yeah, so it's and that's the issue with policy. Yeah, certain things, like for example, we've talked about this before, where and we everyone gets a lot of hate, and the crowd comes for you and the mob comes to attack you. But when you talk about the keto diet, we said there's a lot of benefits from it, right? There's a lot of benefits in improving your metabolic health, in losing weight. But people who are at risk for heart disease, or who have had a heart attack before, keto diet is not ideal for them because it does raise your LDL levels. Right? So you cannot just go ahead and just tell everyone to go on the keto diet because it's person specific, it's population specific. There are certain types of population that could benefit from a certain type of diet, but it's not for everyone, right? And you can't make policy that is only okay for a certain part of the society versus not okay for a big large chunk of the people that are part of your country.
No, for sure. And I think, that also makes me, question a little bit. Like, does the average person actually think about or care about the latest Health and Human Services governmental federal regulation or recommendation on diet? Like when the average person is going to the grocery store and buying stuff, when the average person is making food at home, when the average person is going to a restaurant and ordering food, I don't think the pyramid, whether it's reversed or upside down or right side up, is on their mind. You know what I mean? It's probably, I mean, this is my opinion. People are going to eat what they like to eat and what they can afford and what's available. And guidelines like this probably are going to be more relevant and make a real change in like school cafeterias, the military, right? Like maybe federal food programs, things that have to go by federal guidelines. I don't know on an average basis how much it's going to affect your day-to-day American household's purchasing habits of food.
Yeah, it's interesting, starting out with these bigger federal institutions or even schools, right? Schools, you're starting out and changing these guidelines for the kids right away. There's an interesting book I've been reading. It's called Skin in the Game. And there's a chapter in there that talks about how the stubborn minority usually is what enacts long-term change, right? People who are a small percentage, 3 to 4%, and they're usually the loudest and the most stubborn, and because of them, most of society ends up changing over time. Usually there's different sides of society. There's one minority that's on the opposite spectrum of each other, and the loudest aspect of them try to pull in people from each side, and these are the people that end up causing change. It kind of makes me wonder if because how politicized our current government and situation is in the country, even though these guidelines are not going to be as widely adapted because people do not pay attention to a lot of these things, people might just start being a lot more louder about it, a lot more vocal about it, and especially at the school level when kids start eating these kind of diets and see a larger change that might cause a society-wide change over time. Who knows? It's hard to predict that, right? I mean, but it is true that smaller populations eventually are the ones that are stubborn do lead to a lot more change than the quiet majority.
Yeah, for sure, no doubt. I mean, but in this setting, it's interesting. I mean, how much change would potentially happen from the smaller groups because these smaller groups are relatively like devoid of a voice. Like people in the military whose food guidelines come from federal guidelines. I mean, the soldiers they do what they're told. And same with people on federal food aid. I mean, they're the last ones that really have the ability to make a fuss and to use their voice because they're already struggling. I mean, their basic premise is to get food on the table for them and their family, for them to organize and have a voice and politicize. It's such an uphill battle. The ones that might, are the parents of the kids that are getting lunches at school. When your kids are not maybe eating what you think is healthy and they're being forced to eat something that you don't want them to eat, that's when I think people might take up arms a little bit more.
When it comes to the kids, parents can be much louder and make a much bigger change. But the other aspect to think about is the wellness industrial complex that you've talked about, right? And with the current administration and the Maha movement, they're quite popular in the wellness industrial complex.
Yeah.
That population can be very loud and are very anti mainstream medicine, right? They think that doctors are lying to them and doctors are not telling them the whole truth, and doctors are bought out by uh, the big pharma or the big food industry, and we're somehow causing, you know, want people to be sick all the time. There's this whole conception of the idea that doctors just want people to be sick so they can give them more medicine and keep their business alive. And that's been a big change since we talked about since COVID, right? Or even maybe before that, but that slow erosion of the trust in medicine has caused people to be very distrustful, and that's given rise to this large wellness industrial complex that is very loud and is very welcoming of a lot of the changes, like you know promoting saturated fats. You've seen, I mean, in the past few years, I've seen beef tallow being such a magical source of
Yeah,
fat
I
for a
mean,
lot.
those videos of people like just drinking it.
Yeah, I mean, it's become such, so popular that, beef tallow chips and beef tallow fries and, make everything with beef tallow, uh, use butter and, eat steak and beef. And that's kind of become a very popular thing online on TikTok and on a lot of these wellness influencers, right? So those are pretty loud voices and could lead to mainstream change. Now, social media, as you know, like things spread much faster through social media than ever before. With TikTok, with Instagram Reels, I mean, people are watching that and people are learning it. Those are the questions I'm getting more and more often, right? Uh, the other thing is with the advent of AI, now people are coming in, looking up certain things, and with AI, we know when you ask things a certain way, it'll answer you a lot of times of what you want to be want to hear, right? What you want to hear, what your search history is. A lot of times, it does give you certain, sometimes biased answer depending on what platform you're using. If you're using Grok, it'll give you certain type of answers versus if you're using Claude or Gemini or ChatGPT. So a lot of people are looking and they're thinking that a lot of things these softwares or these platforms are telling you is true, and then they come in and argue with physicians and say, hey, this is what AI is saying. What do you think about that? So it does
Yeah.
it, it does create a lot of issues in that few minutes of patient physician visit that you get in a busy clinic day, and how to educate people about their diet, about their medications, and address the actual concerns going on with their congestive heart failure and coronary disease. So,
Dude, I think that's why, like that exact problem that it's just you can't do all of that well in the time constraints that are required when you have an insurance-based practice. And I think that's what's given rise so much more to the concierge and direct pay models because it allows patients and the doctors to have more time with each other. You're less restricted. You're less of Okay, I see a patient. Let's see the next one. Let's see the next one. You don't have to worry about getting a very specific and nuanced referral that's faxed over to your clinic from a PCP, depending on which type of United or Aetna or Blue Cross the patient has. All of those other factors that actually very much limit your ability to do what you'd like to do with the patient. And the reality is that nothing is free, right? This is a professional service. If a patient wants to talk about wellness and longevity and all of that stuff compared with showing up to get their broken bone looked at and treatment guidelines, or they had a heart attack and now they need to follow up. Like those are very defined things. They have specific diagnosis codes, there's specific treatment lines, and that service is for a fee based on insurance. Whereas just general wellness, longevity, discussion of supplements and all that stuff is much newer, I guess, in the sense that it doesn't really exist in that insurance manual. It's not like a traditional thing that doctors do. So, like some of this wellness industry, I think, like you're saying, there's a lot of snake oil out there, but some of it is addressing a need. I'm not saying it's necessarily addressing it the right way, but I think it's a very big avenue that physicians who have good intentions and really want to get into this stuff, there's a space for it. Like patients want this. They want more time and an honest conversation without constraints.
Yeah, and it'd be great if more physicians are able to get at that, right? I mean, it'd be great if someone who's gone through the years of training has taken the Hippocratic Oath and knows how medications treat you, what is the importance of evidence-based medicine, and is well versed with a lot of the new treatments that have come in the past and are in the future, versus someone who just picks up a mic and gets on the computer and starts recording and does a 15-minute Google search and reads about it and then just regurgitates that on social media. There's a lot of that too. There's a lot of people who are very untrained and are entering the wellness space and guiding patients by just doing some few Google searches and just regurgitating those facts. So that's the
Yeah, I mean the opportunists are always going to fill the void before the experts. That's because it's easy for them.
it's easy for them. So it's a tough space, but I think, I mean, I do try to, in my patient visits, I do try to now incorporate a lot more of this, talks about wellness, health, and nutrition. I recently, what I did was, and this is a conversation we've had about AI. I created this little handout for my patients about, the diet, the proper use of Mediterranean diet to reduce cardiovascular disease, and also a packet of exercise. And all I need is just a click on my EMR ordering software. I just click it and it prints it out for the patient. And we talk about it a little bit. The visit is more of a follow-up visit, and I'm just giving them the results. Then I use that time to kind of talk to them about their diet, and because that's a big need. Everyone wants to talk about that. Everyone wants to talk about diet and medicine and diet and exercise and how they can treat something naturally, right? So I think I think it's important for doctors to be able to make that time, but you need a big major shift in healthcare policy of how doctors are compensated, how our healthcare model works. And I'm hoping with the changes in technology now, we'll have more time and more resources to educate patients on that.
Yeah, totally. And just like to, it's almost like so much of medicine is rewarding the intervention rather than rewarding the prevention and like the ongoing care and health. Like you do a procedure, whether a cardiac cath or a joint replacement surgery or anything like that, that procedure for the unit of work involved, it pays a lot more versus like you just check in with a patient and make sure they're eating the right stuff, they're, on the right supplements needed for their thing. Um, which is also just as important, if not potentially more important for most patients, right? The number of patients that I see in a given year, the number that actually end up doing a joint replacement on is very few compared to just the amount that are there for a check-in. They had an injury or so many patients, so many more patients whom I'm seeing that are coming in just to get evaluated that want to know, like, are they on the right track? What else can I do for long-term health of my shoulders, of my elbow, my wrist, this and that? People talking about bone health, it's a big thing. And even the patients I'm doing surgery on, I mean, I'm getting questions now, like very specific, detailed questions from patients of, like, what should I eat before surgery and after surgery. Like patients want to know how I can optimize myself. Like the mindset I think has really kind of changed. And I think it's awesome that it's not just okay, I'm going to show up. The surgeon's going to do something to me and now I'm on my way again. Like they want to be part of the process and I think it's awesome. I love that because like surgery is not at all the only thing. You have to optimize yourself and nutrition is so important. And people are genuinely interested in that. And I wish there was more of that across the board. I think it's so important.
Yeah, for sure. We were talking about the politicization of healthcare and healthcare policy, and one thing that I kind of remember from a few years ago was the body positivity movement, right? And the whole idea that a lot of people were saying that, hey, I'm happy, I'm obese, this is I accept who I am, and this I'm going to embrace that, and you can't tell me that I'm any less because I'm obese. But then came along the GLP-1 medications, right? And then you see everyone just losing weight and getting skinny and improving their health. And during COVID, we found out that people who were obese, uh, were overweight, were struggling much more from COVID-related deaths than people who were not obese, right? So
Yeah, I mean, it's like, the body positivity and so-called political correctness aside, I mean, it's like unquestionable being obese is less healthy than not being obese.
yeah,
You
but
know, like
it was shamed upon, right? I mean, that was a thing a few years ago where it was hard for doctors to counsel patients about losing weight because people, rightly so, would get offended because it hurts to be called obese, right? It hurts when someone tells you, hey, you're not in shape, you need to lose weight. And kind of body positivity movement kind of stemmed from that, which I don't hear so much from about now because people have figured out ways to lose weight. We know losing weight is important, and a lot of that gone away, I feel, and people are focused on getting healthier, losing weight, building muscle, eating healthier, and we know that's important. So the reason for me bringing that up was because there's it's such a great polarity in our society where there's the left believes in something and everyone must fall into that camp, and the right believes in something and all your beliefs must be according to that camp, right? There's no intermingling and there's no kind of nuance. Okay, this may be right, but this is not right. The right side is right about these things and the left side is right about these things. Maybe you guys should talk and figure something out because you both are right about certain things and you both are wrong about a lot of things, right? So there's no
yeah, I
middle
think,
things.
and that's like how most people are. I mean, even outside of health and diet, just even if we just think about like politics alone, I don't think I've ever met a single human being in my life that is 100% in agreement with everything that a Republican says or everything a Democrat says. Like, a lot of human beings have very different opinions about different things, and that's like, I think that's what's normal.
But that's not true.
Most
That's not
people
true.
are just people, but it's like you're forced to pick a side, and now everything has to fall in line, or you just overlook some stuff.
Well, that's what I'm saying because I've encountered so many people who, because they align themselves with the Democratic Party or Republican Party, every single one of their beliefs is in line with the party line. It's like you don't have a brain of your own to think about
Yeah,
certain
they're
things.
just miming like the BS that's spouted.
Yeah. So yeah, I mean, you're believing every single thing that this party has told you. There's exact platform, and these are the things you believe in. Do people have a brain of their own to think, okay, and do have the nuance to be able to say, okay, there are certain variations of what I believe in, and there are certain things that I believe in on this side, and there are certain things I believe on this side. But some people just truly just fall in line, and that's when I know that these people do not really have a belief system on their own, and they're just being told what the party's telling them to say, right?
Yeah.
So that's not very healthy either. But the same thing happened with the whole vaccine debate, right? Uh, and I feel bad for a lot of the pediatricians because the evidence, the guidelines, the data, and our history tells us that a lot of these vaccines are very safe. There's proven benefits. I mean, we at some point eradicated a lot of different diseases, right? Which have started to come back because of mistrust of vaccines over time, and RFK Jr. had a huge role to play with that.
Yeah, no kidding. You know what's funny about like I don't know, like this whole anti-vax movement and thought process about vaccines is that like I understand. I don't agree with it at all, but I understand the people who are anti-vax. Like they're just across the board for whatever evidence they have read, and that's the hill they'll die on. They just believe vaccines are harmful. Okay, fine. I disagree with you. I think you're wrong. But whatever, you have a belief and it's based on what you think is real evidence. Okay, good. The people I think are even like, I'm just gonna say it, even weirder or like, I think it's even stranger, are the ones that kind of pick and choose. That there's a set vaccine schedule, based on age, based on dose, based on prevalence of diseases at different age groups and within the society. It's like very well studied why we give certain vaccines at different times. But the people that literally will pick and choose, well, I would rather do the MMR vaccine 5 months from now. But I don't want to do it with the rubella. I'll come next week for that one. And then Hep B, no, we just don't do Hep B. But like, I'll take the Hep B A one. It was just like, what?
What do you?
Where is this coming from? It's even more ludicrous. I mean, it's just so
Basically,
random.
right?
It's so random. It makes no sense at all. I mean, I don't understand it. There's different vaccine schedules in different countries. That's a thing. But like I'm talking about, and this is the real thing. If you look it up, like there's some parents for their kids that just randomly pick and choose. Like, well, this one at this age, this one at this. I mean, this isn't a buffet, bro.
Yeah.
Like it's
What are you basing these new schedules on? Who's telling you
exactly
which vaccine is due when? And there's a set guideline based on evidence of when these vaccines should be given. But these are the same people that next day line up and go to their med spa and get a bunch of peptides injected into them, right? Without any research or data.
right,
So,
right.
right?
That's why I'm saying. That's why I like. I still can understand the people that are vehemently across the board anti-vax. I don't agree with it, but like they have whatever evidence or documents that they've read that has just convinced them. But this other group that's just kind of randomly choosing, it's just like there's no basis behind it. I don't even understand that.
Yeah.
It's
I mean,
wild.
we've talked about this, right? I mean, COVID was a big event, right? There's life before COVID and life after COVID, as you remember, right? I mean,
But
life,
yeah, I mean, it's a sentinel event for everyone that was alive during it.
it was a sentinel event, right? And then you and I were in a different stage, right? We were in the hospital. I remember walking across the ICU, seeing people, laying prone, struggling for their lives.
Yeah.
I remember being in the ER with just the mass hysteria and the fear that everyone had of being diagnosed with COVID in those early stages. We were directly treating that. We were being pulled away from cardiology to help people in the ICU because just the mass casualties, the deaths everywhere was just ridiculous, right?
Yeah, it was unprecedented. I mean, no one knew what the hell was going on.
It was unprecedented. And what we were doing at that time, what the medical establishment was doing, was trying to figure out. No one has answers, right? We don't have answers right away. When we try to figure things out, yeah, we will get some things wrong. We will get some things right. Now, if you're going to go and cherry pick, oh, during the COVID pandemic, they told us this and they were wrong, and that's why all of medicine is wrong, and all the doctors cannot be trusted. You're the fool because you weren't there and you weren't the one treating these patients and you weren't making these decisions. Who are you to say that just as part of society we're all human beings together trying to figure out how to deal with this big pandemic that's never happened before, right? Yeah, these now, that's a whole different debate of was this created in a lab in China versus something that happened naturally. But at that time, all of us as human beings were dealing with this disaster that we were facing in our hospitals. And now a lot of mistakes were made. Those initial guidance from Anthony Fauci and people who were leading at that time to when to wear masks, when not to wear masks, when to keep distance. There was a lot of confusion in the beginning, and that created a lot of mistrust. I think all of us were trying to figure things out, how things were going to be, and no one knew the right answers. No one knew if hydroxychloroquine was the right medication.
Yeah.
Bodies were supposed to help you, or what's it called, the other medication, the anti-parasitic medication that everyone was taking. I'm blanking out on the name right
Yeah, yeah.
now.
I'm forgetting the name too, but yeah, yeah.
Trials, and then at that point, COVID vaccine was created, right? And the COVID vaccine came in, and a lot of people were against that because of all these ideas that were being flown out from, you know, by a lot of the naysayers, right? So, and at that time, I mean, we were as healthcare professionals were excited to get the vaccine because we were on the front lines. We were we had families to go back home to. We were afraid every day that we were going to take this virus back home and hurt our loved ones, right? My wife was pregnant at that time, and I did not want to give my wife that the COVID or future baby that virus as well. And I wanted to get the vaccine as soon as possible, so there's some kind of protection. But in the hindsight, I mean, maybe the rollout could have been less political. But
But
it's
that's just how it is, like when like the people that are these like self-proclaimed gurus now that have the power of hindsight. I mean, science doesn't happen instantly, right? Science is based off of data and a study of the data. And when something unprecedented happens, you don't have data. The data is happening in real time, and the study of it is happening in real time. So what do? All you can do is you can use the best logic and the best extrapolation from prior things like that. And what does that mean? If something is conducted in air, cover your mouth and nose to protect yourself and someone else. I mean, it's not like a far-fetched thing. Was it absolutely necessary? Like in the moment, it's less important if 5 years from now we look back and say, was it absolutely necessary? In the grand scheme, if it protected most of the population, had the potential to, in something that is so unprecedented, I mean, just shut up and do it. This is called the collective good. But really, what COVID showed is there's not really a collective good in society. Everyone was just freaking out and worried. Well, why do I have to wear a mask? Why do I have to social distance? Why do I have to get the vaccine? It's like, dude, if everyone does it, we're in this together. We're gonna find out as we go. No one knows. Like, I think that's what irked me the most is people who were getting mad about all of this stuff when this was happening, as if someone should have known, or as if someone is making a mistake. Is all of society collectively was figuring this out across the planet. It hadn't happened before. So, like, for people to just get pissed about it, I mean, it's unfounded. It's just something new. It's never occurred.
Obviously mistakes were going to be made. I mean, there was no
Yeah.
way, yeah, right? No way to get everything right. You cannot deal with something like that and just get everything right step by step. Like I remember seeing this thing where someone was like, okay, like where are they getting the 6 feet distance versus 10 feet? Why not 10 feet?
Yeah.
Why not 7 feet? Bro, that's how you make health policy. You pick a number and you tell everyone to do that so everyone can follow certain guidelines. If you tell you, oh, maybe 6 to 10 feet, everyone's going to confuse.
Right, right.
Number, tell the masses, try to follow it together as society. And that's how public health policy is made. You have to give clear
Yeah.
guidelines, right, to people.
And even, if you think about it, right, like, I mean, think of another situation. Think of like war, okay? In war, unfortunately, every war that's ever happened, and probably every war that will happen, there are bad things that happen. It's not just two armies fighting. It's not like the movies where we line up a bunch of soldiers, they fight, and then the war is over. I mean, there's a ton of civilians that are killed, property that's damaged, livestock that's destroyed. I mean, the foundation of society is shaken to its core. And in some parts on purpose, in some parts it's just unfortunate. That is just a reality, the sad reality of warfare, that bad things happen even though the intent might be different. There's always negative side effects, negative consequences. And COVID, in a lot of ways, was the same thing. The intent was that society gets over this and we move on. And yeah, you might have negative consequences. You may end up having COVID treatments that were proposed at the time that were not as effective. You might have overlooked some treatments that later on were found to be effective, right? Like rules about social distancing, rules about how long to be in quarantine after you're exposed. All of those things, data came out later on, and we found out better evidence later on. But I just think it's like similar in that sense of warfare, that there is always going to be unintended consequences when something unprecedented happens. You can't have it any other way. There's no perfect reaction to something like that.
Yeah, definitely. I think it's really sad, and I think more people are suffering because of that. Just how politics has kind of infiltrated health policy and healthcare, and now everything has become so politicized, and a lot of good innocent people will get harmed because they choose uninformedly not to take certain treatment because they were told by someone that they believe in is that medication could be harmful for them. And I see that all the time with certain cardiovascular medications like statins, where there's a lot of misconceptions being spread about those medications, and people are refusing to take those. And I've seen people literally refusing it, and a few months or years later have a major cardiac event. And it's sad. It's sad that I wish these people. I don't blame them because it's not as simple. I can see where they're coming from, and they wonder why, oh, I have to take this medication when there's all these kind of rumors about this medication being harmful. These people are truly scared for their health. They really, truly care because they don't want to put something harmful in their body. And I don't know how us doctors in the healthcare community will gain that trust back for majority of our patients. I think that's why I have faith in mediums like this, as doing podcasts where we can go on, have these clear, nuanced conversations about these topics, and bring these topics up, and maybe it'll get to one or two patients where they'll see, okay, why is my physician recommending certain things to me, and what is their thinking behind that? And that's why I think two docs, one mic is is I hope to be way to spread that message
Hopefully combating the mistrust.
if someone starts listening to us.
No doubt, no doubt. Well, it's been real, bro. Here's another episode, Two Docs, One Mic. We'll catch you guys next time.